After all, who wants to get old? Everybody wants to turn the clock back. Do they not, Dr. Cohen?
They do. And interestingly, when I listened to your last segment, I realized that it's not just about youth, it's about establishing wellness and health and proactively taking care of ourselves before we get sick. Because now with genetics, we know what is going to ail us, and we can head this off at the pass rather than wait until we develop our cancer or our heart disease. So all of this fits into these concepts of wellness and longevity. It's not just a matter of looking better, it's actually making our cells healthier and beginning to proactively structure our health care so that we can take advantage of longer, healthier lives.
There are two topics, or maybe even three topics, that we can all relate to. That is cancer. It affects so many of us, if not ourselves, people we know, aging and death. And this seems to be looking at prolonging life and dealing with all of those things. So just explain to us what the cure-all, what the magic is that is found within a stem cell and how it works, but in sort of terms that we can understand.
Well, so let me make it simple. There's an experiment that was done where they took an old mouse and a young mouse and they joined their circulation together. And when they sacrificed the old mouse and the young mouse, they found that the old mouse's organs, the heart, the brain, the lungs, all became younger. And the old and the young mouse, all of their organs became older. And why? Because of these kinds of circulating factors that are produced by stem cells called exosomes. And so as we begin to learn how cells communicate with each other, we realize that our cells send out signals when we're not healthy, and they ask for help from cells that are healthy. And as we begin to capture these mechanisms and understand how they work, we will be able to treat the frailty of aging much more effectively, not just appearance-wise, which of course I love because that's my job, but I'm talking about health-wise as well.
But doctor, how far away? I mean, what you're talking about, if true, absolutely amazing. We would all welcome that. But it does, in a way, sound like science fiction. How far away could it possibly be?
Well, if you want to fly to Panama, it's about, I don't know, how far away is that, 10, 11 hours from London?
Yeah.
You can go have these treatments right now because we can actually use allogeneic, meaning somebody else's cord stem blood cells, and these will actually have remarkable effects on aging. And these have been measured with biomarkers. So these are now becoming legitimate concepts, not like far-fetched science fiction. I suspect within the next 5 years, we'll be doing these kinds of things.
This is amazing news because all around the land, all around the world, but all around our audience who's waking up today, Doctor, it's full of people who are rubbing gels on themselves to negate pain, to breathe life into their aching muscles. Wrinkles. And I'm talking to one beside me here who's rubbed her neck today.
Oh, yeah, I did my neck in the night. Yeah. I'm creaking gait now.
And you do the wrinkle thing as well.
Yeah.
But, I mean, this is the cure-all for everyone. And you're saying that it's perhaps within 5 years, touching distance for all of us.
Yeah, I think that the paradigm of medical care is going to shift to, we know when we're born what direction we're headed. So if everyone in our family has heart disease, we may go on Lipitor when we're 5 years old. If everyone has a genetic predisposition to cancer, we're going to be able to diagnose cancer when the first cell breaks off and goes into the bloodstream. Maybe it's like treating an infection. You take a week of antibiotics, in this case, a week of chemotherapy. So as the paradigm of healthcare shifts to a more proactive approach using regenerative medicine and longevity concepts, I think we're going to live longer and healthier, and we're also not going to drain our system, as you guys were discussing earlier. any of our systems.
You see, you hit upon a key area there, Doctor. You said we'll live longer and healthier. My mother has just died. She was 94 years of age. I would not want to have lived to her age because she lived longer, but she didn't live better.
Exactly. So if we extend healthy living by 1 year, do you know what that saves the world in healthcare costs?
No.
$54 trillion if we extend life, healthy living 1 year.
But goodness
Meaning
me,
if we go on a diet.
I mean, there's so many ethical questions to all of this. And I want, if we do live longer, we keep having babies. We need people to die. Otherwise, we're just going to cramp the whole planet. I mean, there are implications to often these things. We're seeing it with AI. You know, we make these huge advancements in science and understanding, but then we kind of open a whole other can of worms, which I want you to respond to. But I also wanted to ask you, before we let you go, about whether or not it's true that pregnant women experience a little bit of this fountain of youth, that they're creating stem cells when they are creating life. And actually there is, I've heard it anecdotally, and I don't know if it's scientifically true, that, you know, often women are said to be glowing, to be blooming when they're pregnant. And is that in any way linked to this?
Very, very possibly. It's a very good question, but I think very possibly.
Okay, and what about the ethical
Again,
question?
circulating factors from, you know, the fetus may absolutely make them younger during the duration of pregnancy. It's very feasible.
Interesting.
Doctor, your work is absolutely incredible. You know, you're a pioneer, you're a longevity expert. Are there those who see you as a sort of Dr. Frankenstein as well? Are there those who fear what you do?
Of course. Anytime there's innovation, people fear. You know, I often like the story of in 1864 when the French decided that it was going to be okay to let outsider artists who were refused to show their art in any establishment heretofore were finally allowed to have their own exhibit. Who were those artists? They were the Impressionists. They frightened everyone, and look at the contributions they've made to our civilization. So I would just say sometimes what frightens us most is actually what we should be embracing, because this oftentimes will lead to the greatest advancements.
Dr. Cohen, I wish we had more time to talk to you. Absolutely fascinating. Thank you for bringing us up to date and giving us that hope that within 5 years we could all be living longer and better as well. Good luck with your research. Thank you, sir. Thank you very, very much.